The same idea that drives the system, which is value defined by outcomes over cost, is as pervasive in the critical care area as it is for our population-based health family practice clinics. It's a system that really is seeking to improve care, do it in a cost-effective way, and critical care is really no different than any other area where we focus on IT, which is innovation and transformation. What Geisinger has done, I think, which is a bit unique in the context of American critical care, has been to have effectively implemented closed intensive care units for almost 40 years, run by intensivists. The developments that occurred in the 1970s, Dr. Burns came to Geisinger from Mayo Clinic and implemented what would have been a state-of-the-art ICU for 2012. He did that in the early 1970s. So there's really a legacy of collaborative, interdisciplinary, intensivist-driven critical care. And the most recent development is the implementation of a tele-ICU that acts as a redundant layer of care, really the nocturnal part of an intensivist at the bedside that we put in really as a quality metric to add to the already closed intensive care units that function very effectively. Yeah, the tele-ICU at Geisinger is basically an extension of the care team at the bedside. So it's a care team that consists of physicians and nurses. All are board-certified intensivists. We don't have the interns, residents, or fellows actually in the ICU. They're there occasionally for educational purposes, but the actual care is rendered by the intensivist and partnering with the critical care nurse. So all of our nurses have a minimum of 5 to 8 years experience, have a CCRN, and it's really the mirror image of the team that is at the bedside. So all the intensivists are on both sides of the cameras, and part of the job description is to rotate through the tele-ICU, which creates the camaraderie, the familiarity, and then the trust when that individual is in the EICU that they can actually effectively provide the care as if they were at the bedside, because they are at the bedside frequently.